Hi, my name is Isabella Nossiter, and this is my nursing 111 head to toe video. The first thing I want to do is make sure that I've gathered all the necessary equipment I need to perform this exam, and I have my stethoscope and I have my pen light. The next thing I want to do is I want to knock on the door. I'll enter the room. I'll provide 360-degree privacy. I will wash my hands, and I will introduce myself. So my name is Isabella. I'm going to be your nursing student today. I'm going to be performing a head-to-toe assessment, and this just gives me a general overview of your health and how your systems are working in your body. So can you tell me your name and date of birth?
Sandra Gourlay, June 1st, 1969.
Okay, so I'll check your wristband. I'll verify it against the medical record, and that is correct. So the next thing that I want to do is I want to go ahead and get her vital signs. So the first vital sign I'm going to get is her temperature, and it is appropriate for this patient that I do an oral temperature, and a normal range for temperature is 97 to 99. And then I will be checking her respirations. So a normal range of respirations is between 12 to 20 respirations per minute. I want to make sure that her respirations are not too shallow and they're not too deep, that she's not using any accessory organs, and that her rhythm is regular. The next thing I want to assess is I want to assess her pulses. So her pulse should be 60 to 100 beats per minute. I want to make sure that the amplitude is 2+ in bounding, and I want to make sure that it is symmetrical and that the rhythm is regular. The next thing I want to do is I want to get her blood pressure. So I want her a normal range for systolic is 95 to 140, and her diastolic is 60 to 90. And then I'll also go ahead and check her pulse oximetry, which should be between 95 and 100%. So the next thing I want to do is I want to assess her pain. So on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain of your life, what is your pain level?
0.
Okay, so if she was experiencing pain, I would ask her for character, onset, location, duration, exacerbation, radiation, and any relief factors. The next thing I want to do is I want to assess her level of consciousness. So since you told me her name and date of birth, I know that she is alert and oriented to herself. Can you tell me who the president is?
Joe Biden.
And can you tell me what the date is?
November 29th, 2021.
Can you tell me where we are?
My house.
And can you tell me what the situation is?
You're doing my head-to-toe nurse's assessment.
Perfect. So she is alert and oriented ×4. Her mood is calm, and she is appropriately answering questions. So the next thing I want to do is I want to check for any invasive lines, IVs, wounds, or drains, which she does not have. Throughout the assessment, I want to be doing a head-to-toe full skin assessment, and I will be looking for lesions, moisture, edema, and I'll also be looking at the color and the temperature of her skin. And the next thing that I want to do is do a Braden scale. So with a Braden scale, that just lets me know if she is at risk for pressure injuries. 23 is the max amount that she can get. Anything below 18 lets me know that she is at risk for pressure injury. The lower the number, the higher she is at risk to have a pressure injury. So the next thing I want to do is I want to look at her head. I will be assessing for any wounds or lesions, which she does not have. Are you having any difficulty hearing or understanding me?
No.
And do you have a hard time seeing, or do you wear corrective lenses?
No.
Okay, perfect. So the next thing I want to do is I want to check the patency of your nares. So I'm going to occlude one nostril, and then I want to occlude the other nostril. Did you have any difficulty breathing?
No.
All right, perfect. So the next thing I want to do is I want to assess her cranial nerves 9 and 10. So her 9th cranial nerve is her glossopharyngeal. Her 10th is her vagus nerve, which is also her gag reflex. So what I'm going to do is I'm going to take my pen light. I'm going to have you open your mouth, and I will be looking in her lips. I will be looking at her lips, her mouth, her tongue, her teeth, and her mucous membranes. And can you go ahead and say ah? Ah. Perfect. So when I ask her to say ah, I am asking for her, I'm looking for her palate to rise symmetrically, which is her cranial nerve number 9. And then I will also be assessing her lids and her lashes and just any external structures of her eye to make sure that everything is evenly distributed, which it is. And then I will also be assessing her cranial nerve number 11. And I will ask her to push against my hand. And then I'm going to have you push against my hand. Perfect. And then if you'll push up. Perfect. Now I'm going to be assessing her cranial nerves 3, 4, and 6. So her 3rd cranial nerve is her ocular motor. Her 4th is her trochlear, and her 6th is her abducens. So what I'm going to do is I'm going to take my pen light, and I'm going to use the star method. And if you'll follow my pen light with your eyes, I'm going to take the pen and move it towards your nose. Just follow the pen light. Perfect. And I just want to make sure that her eyes evenly cross and constrict, which they do. And then what I'm going to do is I'm going to dim the lights, and I am going to look into each eye. Using the Perla method, I want to make sure that her pupils are equal, round, reactive to light, and accommodating, which they are. So the next thing I want to do is, if she was lying down, I would at least set her up to a 45-degree angle. And I want to assess for any jugular vein distension. So I would look on either side of her neck, and she does not have any. So the next thing I want to do is I want to palpate her carotid artery, doing it one at a time so I don't occlude any blood flow. I want to make sure that her rate and rhythm are even, symmetrical, and her amplitude is 2+ or bounding. I also want to auscultate her carotid artery on either side, and I will use the bell of my stethoscope, and I will listen on either side, and I will be listening for S1, S2, or no sounds. What I want to make sure we do not hear is any swooshing or bruise, because that could indicate turbulent blood flow. So the next thing that I want to do is I want to have you do a little bit of range of motion. So I want you to roll your shoulders forward. I want you to roll them backwards. Perfect. And then I'm going to have you bend your arms towards you. And then I'm going to have you flick your wrist towards yourself. And then flick your wrist downward. Perfect. So the next thing that I'm going to have you do is hold out your hands. And I am going to be checking capillary refills on all 10 fingers, making sure that it is less than 3 seconds. I will also feel for her radial pulse. And I want to just make sure that her amplitude is 2+ or bounding, that it is symmetrical, and that her rate is 60 to 100 beats per minute. So then I'm going to give you my fingers, and if you will squeeze them, I'm just making sure that her grip strength is even. And then if you could close your eyes, can you tell me where I'm touching?
On the outer upper arms.
And where am I touching?
The lower outer arms.
Perfect. So the next thing that I want to do is I want to go ahead and listen to her lung sounds. So with her lung sounds, I will use the diaphragm of my stethoscope. And I will want to listen to all 5 quadrants. I will, or all 5 lobes. And I will also want to make sure that her lung sounds are normal and clear. I also want to make sure that I do not hear any rhonchi, wheezing, stridor, or crackles. So using the ladder method, I will auscultate all 5 lung lobes. And then if you could raise your arms out, I'm going to auscultate on either side. And then if you could lean forward, I'm going to again auscultate all 5 lung lobes. So the next thing that I want to do is I want to go ahead and I want to listen to your heart. So I want to, the first place that I want to listen to is your point of maximum impulse. So it is in your left mid-clavicular line at the 5th intercostal space. When I'm listening to long sounds, I will use both my bell and my diaphragm of my stethoscope. So I would listen for 1 full minute, making sure that your rate is 60 to 100 beats per minute. So the next thing I want to do is on your right sternal border in the 2nd intercostal space, I'm going to listen to your aortic valve, making sure that S2 is louder than S1. Then I'm going to move to your left sternal border on your 2nd intercostal space, making sure that S2 is louder than S1, and this is your pulmonic valve. The next thing I'm going to do is move down to your 3rd intercostal space, and I will be staying on the left sternal border, and this is Erb's point, where S1 and S2 are equal. Then I'm going to move down to your 4th intercostal space. I will be listening to your tricuspid valve, and S1 should be louder than S2. And then I'm going to move down to your 5th intercostal space, and I will be listening to your mitral valve, making sure that S1 is again louder than S2. So the next thing that I want to do is I want to assess the AP diameter of your chest. I want to make sure that it's twice as wide as it is deep, which it is. I will also inspect the contour of your abdomen, making sure that it is either round or flat, which it is. So the next thing that I want to do is I'm going to ask you, have you had any urinary incontinence or retention?
No.
And when was your last bowel movement?
This morning.
Perfect. So next I want to use my stethoscope, and I will use the diaphragm of my stethoscope. I will start in the right lower quadrant, move up to the right upper quadrant, move over to the left upper quadrant, and down to the left lower quadrant. So I will listen to each quadrant for at least 1 minute, and I want to hear 5 to 30 bowel sounds per quadrant. And if no bowel sounds are present, I will listen for 2 to 5 minutes in each quadrant, and 5 minutes is best practice to really ensure that there are no bowel sounds. The next thing I want to do is with a light dipping motion, I am going to assess your stomach. Do you have any tenderness?
No.
I would also be feeling for masses. And then I would also palpate the femoral artery, which is right here. So the next thing that I want to do is I'm going to have you stand up. And I am going to have you raise your right leg, raise it back, raise it forward, and I want you to rotate that ankle. Perfect. So I'm going to do that again on the left side. Perfect. So you can go ahead and sit back down. Okay, so the next thing that I want to do is I'm going to have you put your feet out. Perfect. So normally she would not have socks on, and I would check capillary refills on all 10 of her toes, making sure that it is less than 3 seconds. I will be checking her tibialis pulse, which is on the posterior inner ankle. And I will also be checking her pedal pulse, which is right here. And I would make sure that I again check it on both sides. I will check for the rate, the rhythm, and make sure your amplitude is 2+ or bounding, and that everything is symmetrical. So the next thing I want to do is have you push up against, there we go. I want to make sure that everything is even and symmetrical. And then I'm going to have you close your eyes. Can you tell me where I'm touching?
The outer upper leg.
And where am I touching?
The lower outer leg.
Perfect. And that completes my Nursing 111 head to toe assessment.